Right, welcome to this week's Ask Me Anything. My first question is, how is eating less and exercise more still passing the do no harm and evidence check? Good question. Hi Jeanette, that's exciting that you're here. No need to stay, I know you've got things going on, but those of you who are joining me, welcome. Please stick your comments or questions in the comments section and I will try and answer them as time goes by. In the meantime, I have quite a few questions already. There's a pinned post at the top of my profile, and if you want to ask me any questions in advance, you can stick the questions in there and I'll try and get to them every week. But today, first question is, how is eat less, exercise more still passing the do no harm and evidence check? And that's a really good question, and I don't actually know the answer to that question, why it's still passing the evidence check. It shouldn't. Hello, Jeanette. It shouldn't pass the evidence check because when we are recommending something, anything, a lifestyle change or a medication or a surgical option or anything, is when we are doctors are recommending something, we have to ask two very important questions. Number one, will it benefit you? Number two, will it cause harm? And eat less, exercise more does neither of those two. Does not benefit you and does cause harm. So how does it not benefit you? Well, we're taught that eating less and exercising more will reduce our risk of developing a condition, in other words, preventing a medical condition. But there's no evidence to support this. Take diabetes, for example. We have a very long-standing, multi-centre, case-controlled, actually, is it an RCT? I think it was an RCT, actually. Or maybe it wasn't. No, it couldn't have been randomised. No, it was randomised. It was not double-blind. So it is an RCT. It's a randomised controlled trial. It's called the DPPOS, Diabetes Prevention Programme Outcome Study. And it's been going on for 20 years now. And we have some pretty robust evidence that shows that eating less and exercising more does not prevent you from developing diabetes. We have pretty robust evidence that it does not prevent you from developing osteoarthritis of the knee, and so on and so forth. So does it benefit you? Well, it doesn't prevent medical conditions, or there's no evidence that does, let's put it that way, and there is evidence that it doesn't. Does it cure medical conditions? Again, no, we have no evidence to show that. Maybe very short-term studies, 3 to 6 months, but nothing beyond that. In fact, all the studies show that, any improvements that you make, for example, say from exercising, those beneficial impacts are independent of weight. So it doesn't really matter what happens with your weight, and so the eating less part is irrelevant. There's some benefits shown from exercise, but I'm not going to get into that. But the eating less, exercise more kind of evidence check is what we're talking about. No, it doesn't really benefit you by curing or managing an illness. Does it prevent long-term complications? Again, no. We have lots of studies, again, to show this. Let's look at the Look Ahead study, for example, which after 10 years was abandoned because it was very clear that dieting, eating less, and exercising more, was not having any impact on long-term outcomes. That's what they were looking for. They were looking for heart attacks and strokes, etc., etc. In fact, they were looking at all causes of mortality, and they found that eating less and exercising more really didn't have an impact. So they stopped the study. So does it benefit you? Doesn't seem to prevent an illness, doesn't seem to cure or manage an illness, doesn't seem to prevent long-term poor outcomes. So no, doesn't really benefit you, does it? Does it harm you? Absolutely. Unquestionably, there is no doubt that going on a diet, eating less, exercising more does cause harm in multiple ways. It puts your body under acute stress. So all of the kind of negative impacts of acute stress we experience every time we eat less and exercise more. In fact, I would argue every time we introduce food rules into our diets, restrictions of any kind, any rules, increase our stress levels, because our body wants to eat what our body wants to eat, and whenever our body wants to eat it, it likes a varied diet. You start taking things out, your body's going under stress. Acute stress, not good for the body, but long-term stress, even worse for the body. This causes chronic inflammation or chronic metaflammation, and we have lots of evidence that dieting, especially weight cycling, which is a normal consequence of dieting, unless you go on one diet and never diet again, which is cool. But assuming you're the kind of person that's been on more than one diet, then chances are you've weight cycled, and weight cycling has been shown to cause chronic inflammation. That is associated with poor health outcomes. It also worsens insulin resistance. So even though we're told to diet for insulin resistance, actually weight cycling worsens insulin resistance. So it has lots of negative effects on the body, and some of them are long term. Some of them are lifelong, especially the impact it has on our genetic code. So the impact on our genetic material, our DNA, the impact on a cellular level is quite profound. So in a physiological way, it causes harm, but also psychologically it causes harm. We know that people who diet are less happy, have poorer mood, poorer concentration, poorer self-worth, poor body image. We know that people who diet it's sort of severe dieting, for example, if they use medications to diet, if they sort of go to quite extreme levels, so starvation, skipping meals, things like that. We know that people who engage in severe dieting are up to 18 times more likely to develop an eating disorder, up to 18 times more likely to develop an eating disorder. So, causes lots of harm. So the original question for those who are joining me is, how is eat less, exercise more still passing the do no harm and evidence check? I don't know, is the answer. I don't know. It shouldn't. The evidence check is very simple. Does it cause harm? Yes, it does, in many ways. Does it improve health? No, it doesn't. So why are we recommending it? I don't know. I genuinely don't know. And this person pointed out if it was a form of surgery. So instead of recommending eating less and exercise more, they were recommending a form of surgery, which is actually causing much more harm than was doing good. Doctors would lose their licenses. And that's a fair point, unless it's weight loss surgery, in which case doctors don't lose their licenses. In fact, they thrive. But if I said to you, I think we should chop off your leg for no good reason, I'd lose my license. But if I say I think we should chop out your stomach, I make a ton of money. All right, that was a really good question. I think this person knew the answer to their question. I've had quite a lot of similar questions, actually. The next question, very similar. Why do doctors believe that fat is the main problem? And I think there's a slightly different question, so I'm going to try and answer that as well. Where's the evidence, they ask. And the evidence is really, it's really basic and problematic. There is no question that fat people have poorer health outcomes. There's no question about that. And so it's very fair to say that fat people are more likely to have X, Y, Z, pick a medical condition, right, that you know is associated with fat. So that's a reasonable thing to say. And that is a non-judgmental statement. As a fat person, I want to know that my risk of certain health conditions is higher. I do want to know that. Like when they said your risk of COVID was higher, it wasn't, by the way, it wasn't. But when they said it, part of me was just like, oh my God, I'm going to die of COVID. But another part of me was like, oh, well, at least they're giving me a vaccine. And they gave me the vaccine first. And actually, I was quite happy with that. So there is some merit to saying, look, we see increased rates of X condition in fat people. In the same way that we can say that about black people. Hey, we find higher rates of high blood pressure in black people. We don't know why. We just know that it happens. And so it's reasonable to be more aware of this. And therefore, when you have a black patient, to think, oh, maybe I should check their blood pressure. It's reasonable, right? To a point. But that's assuming that any interventions that you might then go on to undertake will be of benefit to the patient. So for example, if I know that black people are more likely to have high blood pressure, and I know that there are very simple interventions that will improve the health outcomes of that patient, then it's reasonable to say, hey, can I check your blood pressure? Oh, it's a bit high. Maybe we should start treatment, because if we don't, these are the risks, and this is the benefits, and and have that conversation, right? Because it's a very, there is an intervention. The problem with weight is knowing that being fat is it increases my risk is neither here nor there, unless you can tell me how to reduce my risk. So, for example, if you tell me that being fat increases my risk of, and I'm going to pick something it doesn't, cervical cancer, it doesn't increase your risk of cervical cancer. But if you tell me that, then I'm going to be damn sure to go for my pap smear every time I need to go for my pap smear, because I know I'm at a higher risk. Okay? Very reasonable. That's an intervention. I can go, I can do my pap smear, make sure I'm going regularly, great. The problem is that people start intervening and telling us to lose weight when weight loss, as I said earlier on, has been shown to cause more harm than it does good. Losing weight is not going to reduce my risk of cancer. Like, there's plenty of evidence to show that. It's not going to reduce my risk of cancer, but it might make my health worse. It might cause insulin resistance, which in turn causes diabetes. I don't want to have diabetes. I can't avoid it, but I don't want to have it. So the issue is the intervention rather than stating very neutrally that there is an increased risk amongst some people. When you know there's an increased risk of anything in any population, the first question you should be asking yourself, especially if you're in public health, is why? Why does this increased risk exist? So, for example, I know that there's an increased risk of pretty much every condition out there as you get older. And the answer to the question why is complex, but essentially as you get older, more things go wrong. That's the basic gist of it. I know that males, I should say, have a higher risk of having a heart attack at a younger age. I know this for a fact. Why? We've done lots of studies into this. It appears that our estrogen and progesterone, so females' estrogen and progesterone, actually protects us. It's cardioprotective, which is why females don't tend to have heart attacks at a younger age, which is why men are at higher risk. That's why. And I could go on, but I won't bore you with all of the information. Why do fat people have poorer health outcomes? That's the question we're asking ourselves now. And here are some of the potential answers. Weight stigma, definitely. Because weight stigma impacts our ability to access healthcare. No access to healthcare, poorer health outcomes. So weight stigma is probably top of the list. Weight stigma and or poor access to health care, and or medical avoidance, all in one category because they're all the same thing. Weight cycling, also, as I said earlier on in the video, puts the body under a tremendous amount of stress, long-term chronic inflammation. This worsens our health outcomes, increases our risk of all sorts of things, including cancer and heart disease, etc., etc. So that could be another reason. There's another very obvious reason why being fat increases our risk of certain conditions. And there may be other ones. And there may be other ones too. I'm sure there are other ones. The thing we have to realise though, if weight stigma and weight cycling are the two things that are at the top of the list, the two main reasons why fat people have poorer health outcomes, then doctors are making it worse. Doctors are worsening our health outcomes, right? Logically. Let's just go over it again. Summarise. Fat people are more likely to suffer from condition X. Why is that? Well, a good chance it has something to do with weight stigma and weight cycling, and possibly something else. Doctors cause weight stigma and weight cycling. Therefore, people end up with... sorry, I've just seen a comment which is really unhelpful, a question about my sister. I'm not quite sure why people are asking me about my sister in this live, but okay. So doctors are causing worse health outcomes, and that is the main problem. So the question here, was a follow-up question, why do medical schools not update their knowledge? That's a really good question, which we should be posing to every single medical school. If there's evidence about weight cycling and weight stigma, why on earth are you not teaching it to your medical students? Because potentially your medical students are going to cause harm to fat people. Why aren't you teaching them this? I don't get it. Why is this not part of the curriculum? I don't know that answer. Really good question. Thanks for answering it. Now, I have a question in the comments, so I'm going to read it out. And by the way, person who apologised for their English, don't do that. Your English is perfect. I had bariatric surgery 10 years ago, restored some weight, not surprising. A doctor, a friend of mine, said that I should use Ozempic. I questioned his suggestion and he told me that I was stupid and a bad journalist. Wow, nice. So all of the studies now are showing that it's around the 7-year mark where bariatric surgeons have to go in and perform a second bariatric surgery. It's around about the 7-year mark. That's what the studies are showing. They're looking at the long-term data. They're gathering up a lot of data, and they're saying, yeah, it's about 7 years when the weight restoration hits a certain point, and that's when we go in with the second operation. So we now know that bariatric surgery really only lasts 7 years. No one's telling anybody that, but that is what the evidence is showing. I've got papers to show this. So I'm not surprised that it's been 10 years and therefore you've restored some of the weight. That's to be expected. That's what happens. So Ozempic is being pushed as the cure for people who have had bariatric surgery, don't want to have it a second time round. And so they have no other option, but Ozempic will work. Ozempic will work for a maximum of 1 to 2 years. It will not last beyond that. You will restore weight just like you did with bariatric surgery. It is inevitable. It's just that we don't have any studies beyond 2 years, conveniently. And so we don't know yet. So you're welcome to try it, and I'm not going to stop you. But in 10 years, when you come back to me and say, I tried the Ozempic and it worked for a while, and then I started regaining weight, I'm not going to say I told you so, because that would be a really cruel thing to say, but I did tell you so, because that's what's going to happen. And the studies are already showing us this. Even at 2 years, people are starting to restore. And you have to be on this medication permanently. The moment you stop it, you will regain weight at such a phenomenal rate that it takes roughly a year to regain it all back. Crazy stuff. Crazy stuff. The maximum amount of weight, that sort of the most amount of weight that you gain is in the first 20 weeks or so. Beyond that, you lose a little bit more, but not that much more. Also, Ozempic is not a weight loss drug. I keep saying this over and over and over again. It is only 1 milligram of a semaglutide, subcutaneous. And the impressive weight loss results that we've seen with semaglutide have been at 2.4 milligrams. There is a study, the second study, the step 2 study, compared semaglutide 2.4 milligrams with semaglutide 1 milligram and proved that semaglutide 2.4 milligrams was much more effective. Therefore, Ozempic is not a good weight loss drug. It's Wegovy. So if you're going to go on one, you need to go on Wegovy. Not that I'm recommending that you should. I have done lots of work on this. There are blog posts. There's a podcast episode, my most frequently visited podcast episode ever. I've done blog posts on this. I've also got a masterclass. If you're interested in learning more about Ozempic, I talk about it in great details. Somebody has said, I have so many misdiagnoses just because of weight stigma. That's another very good reason. To the person asking about my sister, please don't. Like, she and I are very separate, and I'm not going to share details about my sister online. That would be totally inappropriate. But I have seen her recently. And she's well, thanks for asking. I'm glad you're not planning on taking Ozempic. That's good. Good news. Right, next question. Somebody asked me, they went on the Macmillan website, which is a cancer website here in the UK. And they read that being, I'm not going to use the O word, fat, increases your risk of cancer of the pancreas, as can diet. And I think they mentioned processed sugar and meat, because these are the two demons. Unless you're on the carnivore diet, in which case meat is then red meat and processed sugar, those are the processed foods now. It's all about processed foods and the ultra processed foods. These increase our risk of pancreatic cancer, and this person was obviously concerned. And I have a mother who passed away from pancreatic cancer, so I too am concerned. And I can tell you that I've looked into this in great detail for obvious reasons. There's 2 things you need to know. Number 1, the diet stuff is nonsense. There is literally no decent evidence. All of the evidence they find is based on self-reporting. It's really poor quality data. It's all it's not good enough. It's just not good enough. So there is no decent evidence that anything you eat is going to increase your risk of pancreatic cancer. And as I'd like to remind you, as I mentioned earlier on in the video, restriction and food rules of any kind increase your stress levels. Dieting leads to weight cycling. Both of these things lead to cortisol release, chronic inflammation, oxidative stress, a reduction in nitric oxide, impact the insulin pathway, etc., etc., etc. All of these things are going to negatively impact your health. So cutting out foods from your diet, not going to help prevent pancreatic cancer. Now, here's the question about, again, and I think we sort of covered it again, but I'm just going to go over it. What an awful thing to say especially if you have pancreatic cancer or you have a loved one who had pancreatic cancer, and you go on the website and it says being fat can cause pancreatic cancer. First of all, that's not true. There is an increased rate of pancreatic cancer in fat people, but as I said earlier on the video, that's most likely because they do not access care. And in pancreatic cancer, this is so important, pancreatic cancer is notorious for being very advanced by the time we catch it, because the symptoms are very vague. Often there's a bit of pain, maybe, a bit of abdominal pain, a bit of back pain, a change in bowel habits, and a bit of weight loss. Weight loss is the most common symptom of early pancreatic cancer. Any fat person on the planet will rejoice when they start losing weight without realizing it. Most fat people, not any fat people, but most fat people are like, woohoo, I'm finally losing weight, yay! They're not going to see a doctor about that. Even if they did, the doctor would pat them on the back and say, congratulations, keep going. So of course it's not getting diagnosed early enough. Of course more people are dying of pancreatic cancer. It makes total, utter sense. But to read that on a website implies that somehow being fat caused the pancreatic cancer. No. Being fat caused the situation that led to the pancreatic cancer diagnosis being delayed. That's what being fat did. So there is a difference between saying there is an increased risk of pancreatic cancer in a particular group of people than saying that causes pancreatic cancer. Do you see what I mean? There's an increased risk of pancreatic cancer in fat people. That does not mean that being fat causes pancreatic cancer. Those two are very separate statements. Why is there an increased risk of pancreatic cancer in fat people? And why is nobody interested in finding out the reason and attempting to fix this? Their solution is lose weight. There's no evidence that weight loss will reduce your risk of pancreatic cancer, not at all. But there is plenty of evidence that weight cycling, weight stigma, medical avoidance, all of that stuff absolutely increases your risk of poor health outcomes. So why are we not addressing this? Again, we go back to that question about medical schools. Why aren't they updating their, curriculum? I don't know. I genuinely don't know. Do they want fat people to die? Is that maybe the thing? They're comfortable with the idea that fat people are dying. But yeah, lazy work on the part of Macmillan. Not surprised. Almost all cancer charities say this. I recently saw something about miscarriage being caused by being fat. Are you fucking kidding me? No, it's not. Are rates of miscarriage increased in fat people? Possibly, but being fat does not cause miscarriage. It does not cause cancer. It does not cause heart disease. It does not cause any of those things. Being fat doesn't cause those things. Being treated like shit because you're a fat person possibly does, probably does. But, you're hard pressed to find the evidence because it won't exist. Another question. Don't forget, if you're joining me, you can put a question in the comments and I will answer it. Another question was, I have been diagnosed with endometrial cancer. Again, endometrial cancer, I'm guessing hyperplasia, and was told it's because I'm fat. No, I've done the research. Again, I've looked. There is no evidence to say that. There are doctors out there that are like, but the fat cells produce estrogen, and that must be what's causing it. No. There's evidence to disprove that myth. Come on now. So no, it has nothing to do with you being fat. Endometrial hyperplasia was caused, and you've even given me the reason. You don't even need to look far because the person who wrote the comment says, I have PCOS. Well, having PCOS massively increases your risk of endometrial hyperplasia. Everybody knows that. Why? Because you're not menstruating frequently enough. And what's worse is it could have been prevented if a doctor had bothered treating you like they should have done with your PCOS. This is a preventable condition. And I'm willing to bet that your doctors didn't do what they were supposed to do with your PCOS. Now you have endometrial hyperplasia. And instead of saying, oh, wow, well, maybe we should have put you on some hormonal treatment before and that would have avoided this. Instead of doing that, they're going, oh, it's your fault because you're fat. And it gets worse, folks. Yeah, Jeanette, they rely on theories rather than the research, of course. And not even good theories, basic theories, theories my 11-year-old can come up with. In fact, probably my 11-year-old would be smart enough to question those theories. I see your question on fibromyalgia. I'll come to it in a moment. So this poor person with endometrial hyperplasia is being denied a hysterectomy, being denied treatment until she loses weight. But they will give her bariatric surgery within a few days. They could book her in for next week, but is being denied surgery because she's fat. And then you wonder why fat people are dying at a higher rate. When I say that doctors are trying to kill their fat patients, I'm not joking around. I'm not being mean about it. I'm being serious. I mean, fine, it's hyperbole for the most part, but in this case, tell me, like, what's happening here? Is that not just a way of speeding up a person's death, ending a person's life by refusing to treat their endometrial hyperplasia? Sure, they may not end up with, full-blown cancer that ends their life prematurely, but they could. It doesn't matter. There's a risk. And they will not allow this person to have surgery. It's disgusting. It's disgusting is what it is. If you're watching, I might try and message you, but if you're watching and you want some support, feel free to reach out. I have a question here. I have fibromyalgia. Will losing weight help my symptoms? No, it will not. Fibromyalgia was one of those conditions that 20 years ago people denied it existed. I'm sure there are doctors out there that do. It's like chronic fatigue syndrome. Oh, it's not a real thing. I mean, it is, because there's plenty of people with it. We don't understand it, do we? No, not at all. It's because we don't try to understand it. We don't try to understand it because, it's associated with disability. It's common in women, females in women, and femmes, I'm trying to use inclusive language here, but of course medical literature doesn't use inclusive language, so it's quite difficult. It's more common in certain communities. It is associated with poor mental health. And so doctors are really, really good at going, it's not a real thing, or, oh, it's all in your head. I did a video about this the other day. It's not all in your head. Nothing's all in your head. What a load. Unless you have schizophrenia or another sort of serious mental health condition and you are hallucinating or you are delusional, then it might be in your head. But we can manage that, right? Assuming you are not actively delusional at the moment, it is not all in your head. If you're experiencing symptoms, you're getting symptoms, and fibromyalgia is one of those conditions. Just had to have a little bit of a soapbox moment there. The question is, will losing weight help my symptoms? No. And let me tell you why it will make them worse. When you lose weight, especially if you do this by reducing your calories, you are actually going to worsen your experience of pain. And in a number of ways. Number one is tryptophan. The second is tyrosine. These are two amino acids that we need, that we get from our diet, that we can't create them in our bodies. We have to eat them. And if you do not get enough of these, you do not create hormones like dopamine, serotonin, which are very important in pain management. There's also a hormone called oxytocin, which is like the body's natural stress reliever, and it's one of the main reasons why people it increases your pain threshold. Oxytocin increases your pain threshold. So you want oxytocin when you're having chronic pain, right? Because it's going to make it more bearable. It's not going to cure the condition because we don't know what causes fibromyalgia, therefore we cannot offer to cure the condition. But in terms of pain management, you want oxytocin, you want serotonin, you want dopamine, and weight loss reduces all of these things. Intentional weight loss of any kind. So your experience of pain will be worse. Also, earlier on in the video, I talked about chronic inflammation. I won't keep talking about it. There's no point in flogging a dead horse. It's not dead, but I won't keep going on about it. But chronic inflammation. If you have fibromyalgia, the last thing you want to do is have chronic inflammation. Also, there's stress, and something I talked about today about joy. When you're experiencing pain, you're miserable, right? Like it's fair to say that it's miserable, it's debilitating, and so one of the ways that you can try to manage your condition, and I say try, I caveat this because I appreciate that that's not always easy to do, but what you want to do is you want to add more joy and reduce as much stress as possible. Add as much joy and reduce as much stress. So if you have a condition like fibromyalgia, going on a diet is going to reduce your joy and increase your stress levels. So again, it's going to impact your fibro. So it worsens your experience of pain, it causes chronic inflammation, and it sucks the joy out of life, which is really no good if you have a chronic debilitating condition. So I hope that answered your question. That is all my questions for today. Don't know if there's any more. No, I don't see any. So that was Ask Me Anything week 4. I have a free course on my website, folks. I don't know if you've seen it yet. I'm very proud of it. I'm going to be adding more and more free courses as time goes by, but I've put the first one on my website. You're very welcome. And so go have a look and check out one of my free courses. It talks about health, redefines health in a way that I think is helpful, and helps people to, I don't know, understand their relationship with their body a bit better, or have a healthier relationship with their body when it comes to, illness. What else do I want to tell you? That's it for now. My next masterclass will be at the very beginning of next month. I will be announcing it shortly. The title of the masterclass is Why Am I Tired All the Time? Hopefully that will appeal to some of you. All right, I'm signing off. I will see you next week, same time, same place. Bye bye.